Dr. Ackerman is one of the First Coast's leading oncologists, and he joins us every Friday to talk about important health issues. And he's going to tell us about something that's been in the news a lot of recent, and also you've probably seen a lot of commercials about hepatitis C. Dr. Ackerman, thank you as always for being here. We appreciate you. We're seeing a lot of pharmaceutical commercials for hepatitis C. It seems like they're more so now than I can ever remember. So let's kind of talk about first, what is hepatitis C for those who might not know?
Well, hepatitis C is an infection in the liver. Hepatitis means inflammation in the liver. And hepatitis C is an infection in the liver that's caused by a virus. And it's affected a lot of Americans. More than 3.2 Americans have this disease.
Wow.
If it's left untreated, it can cause liver damage. Advanced liver damage is cirrhosis. And even some patients can get liver cancer as a direct result of the hepatitis C virus infection.
So who is at risk for hepatitis C then?
Actually, anybody can get hepatitis C. But most interestingly, the population that has the highest prevalence of hepatitis C are the baby boomers, those people who were born between 1945 and 1965. And the reason is interesting why this group of people have a higher prevalence. The reason is because we didn't really understand hepatitis C for many years. We knew about hepatitis A, we knew about hepatitis B, we were able to identify those viruses, but we also knew there was a group of patients that didn't have hepatitis A or B, and we called them, when I was a resident, when I was in training, we called them hepatitis non-A, non-B.
Okay, but you didn't know what, well, C would have been the most logical choice if I had been there, A, B, C, by default.
Well,
anyway.
we didn't have the brain power we have today. We should have had you there.
Right.
But we finally identified the virus, and we call it hepatitis C. So since we couldn't identify the virus, we couldn't test for it, we couldn't test blood products for it. So many people received transfusions, or people got injections. Back then, we also used needles more than one time. We just sterilized them and use them again. We couldn't measure this sort of stuff. We didn't fully understand it. So people were inadvertently infected with the hepatitis C virus back in the 70s and the 80s.
Okay, so what are the symptoms then? How do you know, and we're going to get into how you can contract it in a second, but how do you know if you have it? What should you be on the lookout for?
Well, most patients have very few symptoms. Most patients are asymptomatic. They don't even know they have it. Asymptomatic means you have no symptoms, so they don't know they have it. But once you get a certain viral load and once it's caused a certain amount of liver damage, you start having some symptoms. The symptoms include fever and nausea and stomach pain, some fatigue, lack of hunger. The Centers for Disease Control, the CDC, urges people in the baby boomer age to see the physician and get tested for hepatitis C. When you don't have to get tested all the time, just once.
Okay.
It's not like a screening test for prostate-specific antigen, or not like getting a mammogram every year, but just get a test to be tested for hepatitis A and B and C. It's a simple blood test, and then you know if you have it, you know if you're infected. I've had the test. If you have an insurance physical, usually that's included as part of the panel when they do an insurance physical when you apply for life insurance. But when you should see a physician for your regular testing, and he or she should get that as part of a
Okay, and you can
package.
request it if it is not part of
Yes.
something prearranged. All right, let's talk about how you contract hepatitis C, and then if there's any way to prevent it.
So hepatitis C is transferred like some other viruses through the blood. Hepatitis C is transferred through the blood, so if you get a blood transfusion, that's the way you can get it. So if you share a needle, so drug addicts have a higher incidence of hepatitis C. People who share simple things like a razor can contract hepatitis C.
Really?
So that's what we think a lot of people of the baby boomer age, just using things like toothbrush or razor. When you use a toothbrush, a lot of people
gums
bleed a little bit, and then your girlfriend or use the toothbrush, whatever, you share it with somebody, and that's a blood-to-blood transference. Also, tattoo parlors were implicated at one time for spreading hepatitis C because the needles were being reused. So the problem with hepatitis C, unlike hepatitis A and B, is that there is no vaccine for hepatitis C. Hepatitis A and hepatitis B you get vaccinated for. And people like me, healthcare workers, I've been vaccinated for hepatitis A and B, but there's no vaccination for hepatitis C. But it is treatable. You mentioned early on in this segment that there's a lot of commercials about it. These are drug company commercials because there are antiviral medications that can be used, And most patients, if treated once diagnosed, if treated with an aggressive course of antiviral medication, can eliminate the about 80%. We can eliminate the virus from their body, and if it's eliminated for 6 months after treatment, most likely it'll never pop back up again.
Okay.
So it's treatable and easily prevented as long as you take precautions
Right.
and be safe.
All right. Well, Dr. Ackerman, thank you, sir, for being here. We appreciate you,
Thank
as
you, Casey.
always, and thanks for the information and for sponsoring this segment. And you can remember, if you have any questions regarding this topic or anything else that we might not have discussed here today, you can visit Dr. Ackerman's Facebook page, which is simply ackerman.com, or excuse me, facebook.com/Ackerman Cancer Center.